everyone, and welcome back to the 9th annual CR Arthritis event. Today, sitting beside me, I have Dr. Claire LeBlanc, who I had the honor of interviewing last year as well. So this is full circle, 1 year later. And today we actually get to talk about a little bit more about your specialty. Dr. LeBlanc is both a sports medicine physician as well as a pediatric rheumatologist, and your work specializes with children and youth in the sports injury realm. Am I correct?
That's correct.
Wonderful. So with that, can I ask Dr. LeBlanc, your session at the pre-course, what was that all about?
Well, I was asked to present some common sport medicine abnormalities or injuries that pediatric or adult rheumatologists might see. And what I tried to do is look at the age spectrum. So I decided that I would take 2 cases that were wrist injuries and 2 cases that were elbow injuries and compare older athletes to younger athletes. And what I wanted the doctors to appreciate is that the younger athlete is more likely to have bony abnormalities, rather the older athlete is more likely to have tendon or muscle or that sort of thing. So I really wanted to give them that sort of age spectrum.
Wow. And I'm guessing because of the different effects, we can actually use, or we should be using very different treatments. Is that ways of dealing with those injuries?
I think, probably the focus that I had in that particular presentation was overuse injuries. And I really focused on the clinical assessment of these kids because you can actually learn a lot just from history and physical examination alone. X-rays can be important, so you want to bear that in mind too. And in some instances, you have to sort of push the radiographic diagnostic protocol into some more fancy schmancy tests such as MRI. But a lot of what we do can be diagnosed with plain films.
Wow, that's incredible. And why is that? Why are you able to know so much just from a simple medical history? For example, a simple examination, because what I'm hearing in the other fields of rheumatology is like genetic testing, this testing, that testing.
Yeah, I don't want to say that we're limited in sport medicine, but I would say that if you have a good grounding in understanding anatomy,
yes,
and in children, the growing anatomy variants, you can already have a pretty good idea of what the problem might be, especially in overuse injuries. And as children get a little bit older and are more into their growth spurts or into their teen years, you can appreciate that what initially we would be thinking more about bony abnormalities becomes more of an overuse tendon or tendon insertion problems. So if you know the muscle groups that insert or come from certain areas of the elbow, you can limit or start to bring down what you think your differential diagnosis might be and then work up the patient in that regard. And there are very, very specific things you can do on physical exam to convince yourself that the diagnosis is one or the other. But plain films can be very helpful, sometimes ultrasound too.
That's really good to know, and I almost feel more relieved. As much as like, yes, genetic tests are great, blood tests are great. I want a human to diagnose it. And I don't know what is about me as a person, but I want to be looked at. I don't want to just be given a requisite to go get my blood work done. I want to see my doctor.
Thank you for saying that.
I want to
that
see
really
my
helps.
doctor.
But I'm going to take it one step further because as I work up my various patients in my sport clinic, as I discuss with the family what I think is going on and what I think are the next tests, we also talk about the whole athlete. And I educate on, 1, the diagnosis of what we're dealing with, and also 2, how to prevent the next one from coming along. So in my practice, I spend a lot of time educating. And I find that alone is beneficial, not just for the patient and the family, but also for myself.
Wonderful. And when you go through that education, for example, do you find that because you are working with a population that is, I want to use the word younger, children and youth, do you find that they're taking all of it in, Or is the family really on board? And really you're speaking to the family. Is it really family care that you're doing? Or is it just the individual athlete?
I actually speak to the level of the athlete themselves as well, because I think it's really important for them to understand. However, the family can be the enemy. Oops, did I say that out loud? What I mean by that is that sometimes the reason why the young athlete has a BOBO, especially a chronic overuse BOBO, is because the coach or sometimes the parent are pushing that child too much, and there's actually way too many hours of training per week. And that if I can educate this family on how to dial that back, we can start having a conversation about how can we educate the coach on dialing that back, and what is your role as a parent to say no. And so I do think that there's a lot of other factors, not just the discussion with the patient and the patient buying in or the athlete buying in, but also the importance of having the entire family understand where I'm going with that and why they have a role to play.
Absolutely. And Claire, can I ask, so if, there's a parent watching right now, and then you do have a child or a youth kind of in a higher, achievement sport, or at that level where they're like really are pushing themselves. They're going to practice 6 days a week and they're at practice 2 to 4 hours a day. Do you have any kind of preventative or things they should keep in their mind at least? Oh, my child seems really tired in the morning. Or, oh, they started limping. Like, what should we be noticing?
I think you've nailed a few very important areas. One is the area of overtraining. And what parents and oftentimes coaches don't fully appreciate is that overtraining in children has a lot to do with the number of hours that they do their sport, practicing and participating in events per week. And so the rule of thumb is the number of hours per week of training or participating should be no greater than your age. So if it is an 8-year-old gymnast, no more than 8 hours a week should be what they're training. And so if the parents don't understand that, I educate them on that. And then they say, well, how do we get that through to the coach? And that's a conversation that either I will have with the coach or the parents will have with the coach. Sometimes I'll do it through the trainer, but bottom line is education, education, education.
Wonderful. And do you ever come into challenges with education? For example, a coach who has been trained in a different philosophy or has, perhaps he was trained in a way where it was based on previous evidence or not full evidence now that we can see the full picture.
Mm-hmm. I think that's a really good point. And sometimes it comes right down to that the parents end up going to a different club. Okay. Because the coach will not back down. If you want to be under me, you must do X, Y, Z. But when you talk about, sometimes I get athletes that are referred to me and they are fatigued. And it's like, why am I fatiguing? Why are my swim times not as good as they used to be? What's going on? And they don't see that their dietary intake is not equivalent to the number of hours they train or to be able to meet their growth needs, et cetera, et cetera. So if you have a youth that's going through their growth spurt that's just eating enough calories to grow, or sometimes not even to grow, they don't have enough for training as well. And so we have a lot of discussion about nutrition as well as training hours per week to be able to really make sure that we get to the bottom of that fatigue. And sometimes it's other reasons, and that's why a good history and physical is important. But a lot of the time it's overtraining and inadequate nutritional intake.
Dr. LeBlanc, I just admire the fact that, instead of all these fancy technologies, which is wonderful, and we love cutting edge technology,
of course, yeah,
there is something so wholesome about just having a really good conversation with someone and you can call it science if you want, but learning to educate your patient or have a conversation with a really, family that's in a certain mindset, that is a science and an art. So,
well, it is the art of medicine, isn't it? And I think with sport medicine, what I like to really talk about when I see families is the importance of the whole athlete. I am not just a doctor for your sore knee. I am a doctor to take care of you as an athlete. And sometimes when I address the knee problem, we discover all kinds of other things that we could be working on to improve outcomes for that particular athlete. So that's what I do.
Amazing. Taking that holistic and
yes, absolutely.
Painting that picture to realize knee injury isn't as simple as knee injury. There's a lot of things that went into that knee injury and caused that knee injury.
Yes.
Amazing.
Yes. Yes.
So, do you have any last pieces of advice for perhaps the athlete? If somebody listening to this is like, oh yeah, I'm a little tired, or I don't really know how to bring that up with my coach.
Well, what I would say to athletes, what I would say to parents, what I would say to general practitioners, even rheumatologists, there is benefit in an athlete, a young athlete, a not so young athlete, to actually getting care from someone who's trained in this area. And that's what I try to do, is to meet their needs. You can go and see an orthopedic surgeon or a plastic surgeon or a chiropractor or other allied health professionals to gain tremendous benefit on certain aspects of care. But a sport doc is going to take care of the whole athlete. And what I would encourage is to come and see me, or people like me that can help deal with all the issues of the athlete in their sport.
I love that. So if you're hearing this, right, finding individuals with the expertise that are able to look at that full picture.
And they don't have to be a rheumatologist. I just happen to do both. But there are some really terrific pediatric and adult sport docs out there, and feel free to gain their expertise because they're really good at what they do.
Thank you, Claire. And with that, we're going to open it up to questions. Do we have any questions, Nita?
Yeah, we do have one question. So you mentioned the healthcare provider, you mentioned the parents, the coach. What about the youth who's playing the sports? Like, how do you educate them that to say, it's not just pain, don't simply brush it away?
Yeah, unfortunately, a lot of coaches push the no pain, no gain approach. So I wouldn't necessarily focus in on that this is the youth's problem or the athletes focusing on ignoring the pain because I need to train. A lot of this is external pressure. But what I tell the athletes is no pain, no gain does not apply to you, ever. And so if you have pain, it's really important to notify somebody early, get seen by an expert as soon as you can, get the proper diagnosis. You may not be 100% happy with the initial management because it may mean you have to slow down a bit and stay away from that particular sport for a little bit to heal the problem, but it's well worth it in the end.
I'm going to chime in after Dr. LeBlanc because that resonates. I had an injury that took me out of my sport, and at no point was there no pain, and at no point did I not want to reach out. It just wasn't appropriate to say anything. So I think, yeah, if my coach let up a little and showed me some support, I would have gotten the care I needed.
Which is really, really key. Yeah. And that's, I would say that for any athlete, no matter what age.
With that then, thank you everyone for joining us. Unless we have another question? No. Thank you everyone for joining us. Thank you, Dr. LeBlanc.
You're very welcome.
See you next year again.
Yes, wouldn't that be great?
See everyone else at the next session. Goodbye.
Bye.